moving on to another topic we're following really closely this week, the latest with mpox. We know the World Health Organization watching this closely. They're having a meeting tomorrow to talk about this. Can we talk about how this strain has changed a little bit since the original one that was discovered in 2022?
Yeah, so there's, for millennia, mpox has been in primarily in Africa, in parts of West Africa. That's called, just to use the technical term, that's clade 2. And then in Central Africa, mostly in the Democratic Republic of Congo, that's clade 1. And more recently, they've identified a substrain of clade 1, so basically an offshoot of the type of mpox that was found in Central Africa. I think people are chatting about whether or not this may or may not be more severe or cause more severe illness or may be more readily transmitted. I think it's fair to say that it's premature to have any conclusive statements on the virulence of this particular strain. What is clear, regardless, is that it is spreading. There are many more infections right now in Democratic Republic of Congo and in neighboring countries and countries in the region, including Uganda, Kenya, Rwanda, Burundi. So mpox is a much bigger growing issue on the African continent. And of course, we know from many other infections, including COVID, including mpox in 2022, that we live in a very interconnected world. We saw a very large mpox outbreak in Canada in 2022, and it has not gone away. Mm-hmm. We still have it here.
And given the outbreak situation that we are seeing in African countries, is Canada at risk of seeing an outbreak here? What do you think?
Well, we already had this outbreak in 2022, and it hasn't gone away. It's grumbling along. So, for example, as of July 13th, 2024, if we're just looking at the 2024 calendar year, Ontario had 102 cases of mpox. Most of them were locally acquired, not brought in from another part of the world. And if you compare that with all of 2023, we only had 33 cases. So we have locally acquired mpox in Ontario. Now, of course, said with love, respect, no moralization, no value judgments whatsoever. But our outbreak in Ontario has predominantly been in the men who have sex with men community. In fact, over 96% of all of our cases in Ontario have been in men. So, risk is not equal. And of course, we've had a very large public health response and with leadership from the men who have sex with men community to make sure people are aware of this infection, make sure people know what the risk factors are, lower barriers to vaccines, get the vaccines out there, lower barriers to treatment. And huge kudos to leadership in the men who have sex with men community for informing the community and providing better safety to the community. But again, this is an issue that is grumbling along in Ontario and Canada and many places that were previously thought to not be endemic. And it doesn't seem like it's going away, unfortunately. Mm-hmm.
And you mentioned vaccines. Vaccines are available for people who would like to protect themselves against mpox. Do you know how effective the vaccine would be against this changing strain?
And so it's unclear with this particular strain. That's a really good point. And all of this is really under investigation. Here's what's likely. The likely scenario is that these vaccines still provide pretty reasonable protection against infection and severe infection if you do have a breakthrough infection. And quite frankly, in Ontario, myself and other people who work in infectious diseases, primary care, emergency medicine, we do see an occasional case of mpox. And sometimes these individuals who are infected have been vaccinated. So these are breakthrough infections. But again, what you're going to see is the breakthrough infections in a vaccinated individual are far less severe than than the infections that we saw, for example, before the vaccines were rolled out. We saw some really sad cases where people were miserable and in pain, and some individuals were even hospitalized with this. I think that's far less common. And in fact, in the 2024 calendar year in Ontario, at least with the 102 cases that have been seen to date, there have been 0 hospitalizations and 0 deaths with those. Obviously, I think we can improve the vaccine rollout in those who are at most risk for mpox, but many people have received 1, preferably 2 doses of that vaccine, and it does go a long way in preventing infection, but really also mitigating severity of infection if there is a breakthrough.
Dr. Isaac Bogoch, thank you so much for sharing your time with us this morning. We certainly covered a lot, so we appreciate everything you're able to share with our viewers.
My pleasure. Have a great day.
Thank you. You too.